Hello, and welcome to this Clinical Care Options podcast. I'm Nicola Hansen, Scientific Director, here with Susan Scanland, gerontological nurse practitioner and founder and CEO of Dementia Connection in Clarks Summit, Pennsylvania, and Robin Martinez, a patient advocate who manages the online communities and patient engagement at Smart Patients, Inc. This episode of Cognitive Conversations will discuss HCP patient communication regarding brain health and cognitive decline, with a focus on geriatric clinical settings. This podcast is part of our 2025 Brain Health Program, in partnership with Practicing Clinicians Exchange, Smart Patients, and the Society for Post-Acute and Long-Term Care Medicine, and supported by an educational grant from Lilly. Please visit the show notes for a link to our Brain Health Resource Hub containing many additional activities. Now let's get started and hear what our expert has to say.
Hi, Susan. It's great to meet you here today. It's good to know that there's a lot that people can do to help preserve their brain function and their brain health. And I think that too often it's something that we just take for granted and then feel doomed. And we don't have to feel doomed. We should feel hopeful and active.
As a gerontological nurse practitioner, what I'm seeing from my patients in the interests of brain health are, for example, the family members, the children of persons with dementia and Alzheimer's, and the siblings of those persons with dementia and Alzheimer's are keenly asking, they're very interested, keenly asking about what they can do to decrease their risk. In mind, this is the baby boomer generation, many highly educated, and they watch their loved ones having to go through cognitive decline, and they are saying, please, what can we do to prevent this? And this comes up with me in social situations everywhere I go anymore, because I'm getting to that age where my friends and colleagues are really starting to see it in siblings and parents. So, if you don't have it and you have a family member, huge interest. I have several clients that have now mild cognitive impairment, and the fact that they want to know what they can do to slow things down. And now we have new medication, the beta amyloid antibodies. And with these new medications, we have to catch the cognitive decline early, either at the MCI, mild cognitive impairment stage, or early/mild Alzheimer's disease. So unfortunately, many laypersons out there are not familiar with the new treatments in Alzheimer's. We're seeing them in the press somewhat now, but more people I talk to say, I wish I knew about this earlier, before my spouse got diagnosed with MCI or early Alzheimer's, or even if they missed that window, moderate Alzheimer's. So keen interest in brain health now. And, we really have to be aware of this throughout the life cycle.
With all the gerontological issues that come up, when you have a patient who comes in, not their family, but the patient, do you always talk about brain health with them, or do you wait to see if they're interested in that as an issue, or do you respond if you begin to see a need that they need to talk about it with you?
Well, as you know, I've been functioning as a dementia specialist. So I'm not a primary care nurse practitioner. I've limited my practice to geriatrics, mostly in nursing facilities, seeing a large number of my patients with moderate to severe. And however, I did open a new Alzheimer's clinic here in the Scranton, Pennsylvania area. And because they would come to my clinic, it was easy for me to talk about that. Obviously, they came to me because they were referred to me. Now, my colleagues in primary care, if the patient is over 65 years of age, a cognitive screening is required to be done by whoever does the annual Medicare wellness, which starts at age 65. So this really should be part of the annual physical exam for everyone over 65. And we know that, Robin, especially over 75, when you start to see rates of about 12% of people will have Alzheimer's, and especially at age 85, 1 out of 3, it gets even more important as you go from the late 60s into the 70s. So it should be part of every conversation as far, do you have any concerns about your memory, or do your family members, if the patient comes in alone, does anybody worry about, how your memory is or how you're functioning, or are you yourself worried? let's talk about that and open up the conversation and see where that goes. But we got to start the conversation because it's interesting. They look at surveys and they find that people will think that their healthcare provider will bring it up. They may be a little shy about bringing it up. So they almost need permission to start that conversation. They don't usually come in and say, hey, I'm worried about my memory. It's more, you've got to kind of pull it out of them. But once you open the door, you will hear what their needs are and what their symptoms are.
How often do you get people who are wondering, is this normal, or am I within the normal range, or am I really having a genuine problem? That's always hard to tell, isn't it?
It depends on how you've been exposed to this problem in the past. Most families, most persons really struggle with this. And, it doesn't matter what your level of education is. It doesn't matter. Even healthcare providers get stuck on this because we've got the old factor that if it's your own, you don't see it. So I think most people struggle with this, which is why the Alzheimer's Association every year puts out a fabulous report. You can go to alz.org. And it's called the Facts and Figures. And in that very first section, I want to say it's around page 11 or 12, they actually have a table that compares normal aging versus dementia. And I think if more people were aware of that, we wouldn't miss so much mild cognitive impairment. Say, this is normal. There could be a problem. Where do you think your loved one is? Even, print it out. It's free information from the Alzheimer's Association. It's really fabulous. What I do tell people who start to say, hey, I'm concerned, mild cognitive impairment, which is, a certain percentage down from normal functioning, is very subtle. And we often call it like the prodrome. And a prodrome means if you've ever had the prodrome from a flu, you just don't feel right, but you don't have the flu, but it's on the way. And there's also a prodrome to cognitive decline. How do we look for that? And how do we teach our clients when they come into the clinic, families and patients, how do we tell them to look for that? The things that show up during, and I'll use the term MCI, meaning mild cognitive impairments, we tell them to look and, are there very subtle memory changes? And they could be really, really fine. Like, oh, I thought you would know that. We went to that place 3 years ago and you talked about it a lot. Now you can't remember the name, that kind of thing. Executive function. Executive function means being able to put together your tasks in a sequence. It's basically planning to do any activity, whether it's cooking. I want to cook this. I'm going to make a list. I'm going to go to the grocery store. I'm going to get X ingredients. Then I will come home and prep the meal. So something as simple as that can go. You can mix up the steps or forget things. The difference between mild cognitive impairment and further down into Alzheimer's dementia, instrumental activities of daily living are higher function things, and the higher function things go first. For example, money, taxes, investments, the person may start to kind of mess things up. They may fall for, financial exploitation. Somebody calls them and they give them their, information when they shouldn't have. It often shows up first in occupations, especially in higher functioning occupations as healthcare providers, attorneys, it often shows up there first. So it's often the coworkers that see it before the family. Another thing, which in the last 10 years, technology challenges. Okay, so many of us are not savvy at technology, myself included. My kids, kind of chuckle, they're young adults, but so basically you want to look at a decline. Was somebody a super tech savvy and now they're messing things up? Or did they always have a hard time with, this, app or this, connecting to their smart TV? You don't penalize them if they never did it, but if there's a change, personality changes can signal MCI, irritability, apathy, just like I'm not that interested anymore. Anxiety and depression can also be a prodrome to mild cognitive impairment. Sleep too, there can be sleep disturbances that can actually be a sign that MCI is on the way. So yeah, they say almost 35 to 85% of people will have those behavioral, psychological symptoms like the irritability and the anxiety and depression. So there's a lot of things we can look for, but if you don't know what you're looking for, that's why I'm really happy we're having this conversation, Robin. It's very important info.
There are things that people with any kind of dementia can do, or any kind of budding problem that might lead to dementia. We're all worried that, of course, we're not so worried about the minor things that happen during mild cognitive dementia, mild cognitive impairment. We're more concerned with where that might lead for most of us, because mild cognitive impairment isn't that big a handicap. But the idea that, holy cow, this could lead to something really serious, I'd better start looking into whether I can do things about it. And of course, we can do that before we develop mild cognitive impairment.
It's been found that probably 50% of dementias can be lifestyle factors, can have a significant contribution. And we really want to start this, earlier in life. But as one gets older, it's very important. We look at risk factors and potentially modifiable risk factors. Weight is a really important thing to think about. Body mass index, we want to have that less than 30. Nutrition, we want to have a healthy diet, and following the MIND diet, which is the Mediterranean diet, with a heart healthy diet. Because what we found with food is what's healthy for your heart is also really good for your brain. Blood pressure. So many people, because blood pressure is asymptomatic, aren't really on it. But I think if providers too need to realize that the new recommendations for blood pressure should be less than 120/80 to minimize the risk to the brain. Other things that we can work on, in the Middle Ages or as we progress in life is hearing deficit. Decreased hearing is found to be a risk factor for dementia just because the normal brain processing doesn't occur if the sensory input isn't coming through the ears. And they also found that for eyes too. Cholesterol, it's ideal we want to keep cholesterol less than 200. Another one, Robin, that I see is a big one, often missed, and I have lots of discussions with folks my age about sleep. Sleep in itself can be a risk factor. Poor sleep hygiene, not getting to bed on a regular basis. Not getting enough sleep is probably the biggest epidemic in our working world. But 7 to 9 hours of sleep is ideal for brain protection. But one of the biggest threats to that is obstructive sleep apnea. So anyone with snoring, I feel, should have a sleep test just to rule it out, because it can cause vascular dementia. It can cause all kinds of cardiac issues, arrhythmias. And, we don't want to miss, this because it causes both vascular and Alzheimer's dementia. We know that the more one stimulates one's brain, the better off they are. We know that higher education is protective. The longer you've gone to school, the more protective it is for your brain. Later in life, you can still do cognitive stimulation, different reading things. Other things I've heard is learning another language, picking up a musical instrument. There's a lot you can do, just getting out there and exposing yourself to new situations.
Do something different, do math games, learn a musical instrument, learn a new language. And the same, like if you like Sudoku, try word puzzles. New challenges are good for helping with mild cognitive impairment and with stretching our mental muscles to help with brain function.
Excellent point. Yeah, you're absolutely right. I do have a friend who does the app for the New York Times. I guess it's like a word puzzle. And she swears that it has improved her recall.
Right. And you'll notice too, I think you go back to something that you did before and you're not doing it as well. And you notice that and you bring your skill level back up to where it was. That's good for brain health.
Absolutely. Absolutely. And another big risk factor for dementia is social isolation. And we saw this during the COVID epidemic, in which, folks were basically homebound and didn't get that socialization and would often get depressed. And we know, too, that depression that occurs later in life is a risk factor for Alzheimer's disease. And if you have a history of depression, it seems that the closer it is to your later years and the onset of dementia, the more of a risk it is, rather than if you had at a young age. But it seems that treatment of depression does modify risk. So at any age, depression should be treated, as thoroughly as it can be. So that social connection, there's been a lot of fascinating studies on all kinds of social behaviors. So get out there and mingle. And they say a number of friends does, decrease your risk. So, force yourself out and to be with people.
Good point. Another factor that often isn't considered is the effect of medications as we get older. One person mentioned to me just recently that they were starting to have some concerns, and they themselves looked into their medications and found that they were taking an antihistamine that isn't recommended for older people.
I know most of those listening to this podcast are geriatric healthcare providers, so they will probably already be familiar with the Beers criteria. Beers, like the drink, but it was a physician named Mark Beers who came up with this list back in the 80s of potentially inappropriate meds. We call them PIMs, potentially inappropriate meds, that can lead to confusion. And like I said, antihistamines, especially diphenhydramine / Benadryl, big culprit, can throw someone into a delirium who's already, kind of in the MCI area or even worse in the dementia area. And other drugs like, benzodiazepines. And I always tell, both healthcare providers and if I'm talking to consumers or patients, you never stop your tranquilizer, your benzodiazepine suddenly because you could have seizures. But I've just been working with another case in which I really encouraged the daughter to talk with the physician to taper them down, because what we know is sometimes when they're on the benzodiazepines, it can have an opposite. We call it a paradoxical effect, the opposite effect. Instead of relaxing them, it makes them more agitated. So meds are huge. So I encourage all those listening to this. You're probably familiar with the Beers criteria. But, do look and use your consultant pharmacist too, because they're great with interactions. But yeah, there are groups of drugs we like to stay away from, including, most of the sleepers, most of the hypnotics too, for brain and for risk of hip fractures. So another thing that's very important is, in addition to sleep, hydration. We want to be sure that our patients are well hydrated because they lose that sense of thirst as they get older. Stress management, because stress and anxiety can increase the risk for MCI, thyroid issues, and so forth. But, some of the things I've talked about during this conversation we're having, Robin, Clinical Care Options on their website has what's called a clinical practice resource. And the name of our section is Integrating Brain Health Discussions in the Daily Routine, because this is something we want healthcare providers to bring up and not wait for the patient to say, hey, they're already doing XYZ and it's already too late. So there's a wonderful infographic that I've detailed all the risk factors to be looked at and discussed. It's a great talking point for patients. It is on the website in the resource section, so be sure and look for that, the infographic for brain health. And I worked with Clinical Care Options to develop that, and it's really nice. And the other thing that's on that infographic, I was one of the 10 experts working on the detection and disclosure of Alzheimer's disease and other dementias for the Alzheimer's Association. So I've summarized, pretty much how you can, when you get that information about someone's got MCI or early Alzheimer's, what to do, how to formalize the diagnosis, and, the steps to take from there, including who's eligible to go on to have more advanced treatment. So just so you know it's there, there's also going to be a lot of great other podcasts from my colleagues. And I really encourage you to share that with your patients, especially the infographic. All right. Well, thank you, Robin.
I really look forward to all this. One last item, if we can work it in. What about pets? Pets that you can cuddle and talk to?
Well, absolutely. It's funny. They started doing pet therapy on persons who already had Alzheimer's back when I was in grad school in the early 80s. There's some of the first studies coming up. But we know even before one gets MCI, there's been studies showing that having pets lowers blood pressure. Lowering blood pressure is good for the brain. Having pets gives you that connection. Emotions can perk you up with your mood. So absolutely, pets have been really, they're just great companions, and definitely works on the loneliness factor. Seems to work on the blood pressure and the whole depression factor too. So. And brain health can be fun. Something that combines exercise and socialization, like dancing, singing. You can kill two birds with one stone with fun activities too.
Sounds great. Thank you so much.
Okay, thank you, Robin, for this interview. Appreciate being able to share this info with you and others.
Thank you very much, Susan and Robin. And thanks to you, the listeners, for joining us. Please look for 4 other companion podcast episodes discussing cognitive conversations in other clinical settings. As a reminder, to visit our full Brain Health Resource Hub, please click on the link in the show notes. As always, thanks for listening.